Hello, everyone. It's Monday, August the 31st. We got a lot to go through today, and I'm going to move along as best I possibly can. I think we've got some information that may be very good for a lot of people, but let me start with this. It's not good. We've had 12 additional deaths since Friday. The 2003 death was a 40-year-old male from Kanawha County. The 2004th, a 70-year-old female from Taylor County. The 2005th, an 86-year-old male from Logan County. The 2006th, a 52-year-old male from Wayne County. The 2007th, a 73-year-old male from Cabell County. The 2008 death, a 77-year-old female from Grant County. The 2009 death, a 42-year-old female from Kanawha County. The 2010 death, a 71-year-old male from Monroe County. The 2011 death, a 77-year-old male from Monroe County. The 2012 death, an 88-year-old female from Nicholas County. The 2013 death, an 89-year-old male from Kanawha County, and the 2014 death, a 58-year-old male from Raleigh County. Now, we all know that that from the federal government standpoint, you know that we're, you know, and I have no idea, you know, the guy just flashed a thing up here, but you know, I don't know what that exactly means, but I know from our federal government standpoint, from the nation, we're at approaching 200,000 people that are going to, that have passed away by this terrible killer, this virus, this epidemic or pandemic. You know, West Virginia's numbers are still great at 214. You know, if you were to divide 50 states into 200,000, that's 4,000 per state. You know, naturally, I know we don't have the population, you know, in West Virginia, but you know, if I misspoke and I said 2,000 deaths in West Virginia, I surely didn't mean that. We've lost 214 people in West Virginia, surely not 2,000, but it's still 214 too many. Now, our positivity rate on a daily basis today is at 2.80, too high. The number of new positive cases in the last 24 hours, 140. That's not good either. You know, from the standpoint of our active cases, they're up from 1,763, you know, and on Friday, but our recovered cases are at 8,017, which is really good. You know, the number of patients that are hospitalized is up from 133 to 139, and our R0 or RT number is up to 0.97 versus 0.89. Now, let me tell you this. We've got a week, basically, a week before school starts. Our color-coded chart ran and just came out on Saturday night. We had counties in the orange. We had, I think, Logan, Fayette, and Kanawha County in the orange and Monroe County in the red. Now, being in the red county, that means everything stops. Practice stops. The school stops. Surely no competition. Everything stops. From the standpoint of the counties that are in orange, we have really worked all weekend to try to find a way to message to all those that are in those counties that are in orange, to some way try to motivate and do all we possibly could while we still have time before school starts to get them moved down into the yellow or green area. And we've had a lot of different ideas and a lot of collaboration between all the parties. If I had a nickel for every phone call that's been made, since forever ago, I'd have a lot of nickels. Now, with that being said, I want everyone to know just two things. The first thing is just this. As your governor, I have to protect the public health across this state. I have to do everything in my power to be able to do that. And absolutely, I am not going to compromise, regardless to the pressure. I am not going to compromise in any way the well-being of our children, the well-being of our counties, the well-being of our cities. I'm not going to do that. Now, and in holding steadfast to that, that's why really and truly we have primarily pitched the numbers that we're pitching, because in doing that, you, West Virginians, have stepped up to the plate and you have answered the call. Now, we have a unique situation and a unique opportunity here, because on the other hand, while I'm the governor and I'm looking out for the public health of all of us in the state of West Virginia, I'm also a coach. And I also know just how much playing sports means to our communities, it means to our children, it means to our schools, it means to all the fabrics in different ways of our lives. So, with that being said, I think we have an opportunity, a real opportunity. We have a week, and then we're going to go back to school, which is by far more important than the sports, but it is absolutely that we do have a week. And so here's what we're going to do. And this is through the collaboration of lots and lots of our experts and lots of people. I have said over and over and over, is there a way that we can find, and I started this really back surely on Saturday, and then through Saturday night, and then through all day yesterday. And so this decision was made way before we got here today. But in all of that, I've been trying to figure out, well, what can we do? What can we do to the orange counties to incentivize them even more to be able to get in the yellow and green? And what can we do to assure that if we allowed competition, what could we do that would ensure us, that would have us the level of safety that we need to have? So here's what we've come up with. For those three counties, now we can't do anything with Monroe County today, but for those three counties that are in the orange, and we have consulted with every health expert, we have consulted with all kinds of people. For those three counties that are in the orange, and that is Kanawha, Fayette, and Logan County, for those three counties, we're going to test every athlete in those three counties immediately. We're going to test all the coaching staff, all those that are involved, the bands, everybody in those three counties. Now, if all the athletes, the staff, and everything tests negative, you're going to be allowed to play. If one person tests negative, we're going to have to step back, and absolutely we're going to have to then reevaluate everything. But what is it going to do? What's it going to do for us more than anything? What's the underlying thing here? The underlying thing here is not so much, let's just get us back to playing. That's not that. The underlying thing is just this. It will give us information. It will give us a lot of information. It will give us information that will aid those counties to get them out of the orange, possibly, before that we go back into a situation to where those kids are not allowed to go back to school. Because if we do that, and that's what happens, those kids are going to start off behind and they may not catch up. And so we've got a week. We've got a week. Is it the best program known to man? Is it perfect? Of course it's not. But we got a week. So what we'll do, we've scrambled all the resources that we can possibly scramble. We'll go test everyone. If the football team tests and they're all good to go, we play the football game. If the volleyball team tests, they're all good to go, we play volleyball games. If the soccer team tests, we play soccer. If the band tests positive, with one of the people on the band that tests positive, the band can't play. It's just that simple. This is the very, very best that we can possibly do. And the other thing it will do more than anything, it gives us information. What if we go into Fayette County and we test the volleyball team and the soccer team and the cross-country team and the football team and we get a bunch of positives? Then we know more about what we're going to have to do to be able to get Fayette County safer from the standpoint of all the residents of Fayette County, safer from the standpoint of being able to get them out of the orange and into the yellow or the green. So that's it. Now, along the way here, I'm going to have, different people talk to you. You're welcome to answer questions, but we're going to run to the fire like you can't imagine right now to be able to test everybody we can possibly test. Everybody that's going to be on those fields or in those gymnasiums that are going to be playing, and we're going to test the coaches. We're going to test everyone. And if at the end of the day, what if we find a player that tests positive? Do we want to know that? Well, of course we do. Most generally, they'll be asymptomatic. Do we want to know if a coach is testing positive? Well, of course we do. And will that help us in that community? Of course it will. So this is the very, very best that I think we can do. It's an opportunity that we have, and it's a one-time deal. This is it. This is a one-time deal. We're not going to go forward because we don't have the resources to go forward. What if we end up in a situation in the middle of the season, we've got 8 counties that are orange, and we say, well, we'd like to test them all. We can't do that. So everyone needs to know, and everyone needs to know right now, right this minute, if you were in the yellow by the map, on Saturday night you play. If you were in the orange, we got to get you tested. And then we got to get everybody passed. And if everybody passes, you can play. If they don't, you can't play. It's just that simple. But we've taken another step to ensure the safety, and another step to ensure knowledge going forward that will assist us in every way. And not only that, it will give us the keys to be able to help get those counties out of the orange so they can get back to school when school starts. So we're basically using this moment with sports to be able to give us the health information, to be able to assist us in getting those counties out of the orange and into the yellow and the green so they can go to school. I think it's a heck of a plan. I commend all those people, from Bernie Dolan to Clayton Birch to Dr. Clay Marsh, to all those people that have worked with me all weekend long and probably got sick and tired of hearing from me. But that's what we're going to do. We're going to move that way and move that way right now. Surely to goodness, everybody, I can't imagine that there's one person out there in one of these counties that wants our kids out on the field playing a game with kids that have tested positive. So in this situation, without any question, it will assist us in every way. If we have a team or kids on the team that test positive, we can't play. And we shouldn't play. That's all there is to it. Same way with the band, same way with volleyball, whatever it may be. So let me keep moving along here and get through as much as I can. In regard to our long-term facilities, we have 36 outbreaks in our long-term care facilities now. They're in Grant. I'm not going to name the facility, but Grant, Kanawha. Kanawha's got an outbreak, and I'm going to go through this, in Meadowbrook Acres, Cedar Ridge Center, and the Marmette Nursing Home. Logan County has Trinity. Mercer County has Princeton Healthcare. Monroe has Springfield, Raleigh has Pine Lodge, and Taylor has Rosewood, and Grant has the Grant Rehab. I said I wasn't going to read it, but I have. In our churches, we have 3 active outbreaks. Our churches are doing better, but we just got to keep on it and stay after your mask and the pews in between you and all that. But in Monroe, Cabell, and Wyoming County are the 3 counties that we have outbreaks today. In our corrections facilities, we have 138 positive results now at Mount Olive. 394 are negative. We have 15 of our total staff, our staff cases. Mount Olive continues to be quarantined and medically isolated inmates as well as are necessary. At South Central Regional Jail, there are 8 active cases and 2 staff cases now. Workforce, I think Scott Adkins is with us today. He can discuss the $400 that's going to be going out to the people. You know, we just received the approval, like I said the other day, last week from FEMA on the $300. The state's going to pick up the other $100. And not only that, but it's all retroactive, I think, back to August 1st. So all these people are going to be getting a nice check, and the faster we can get it to them, the better. You know, our Mon County bars are set to reopen today, and we've confirmed with the medical experts that our numbers are stable there, and we're excited to be able to get these businesses back to work. However, you know, we caution them in every way to do any and everything that they can do to follow the guidelines, and we'll be watching it. If we got to shut them back down, we shut them back down. That's all there is to it. We'll do it, you know, in a heartbeat if it doesn't go well, and so let's just hope and pray that it does go well. The DMV extended the expiration on, let me read here, on your driver's license, instruction permit, your graduated license or commercial driver's license. You know, that expiration date has been extended from March 1st to December the 31st. And we've changed rules that were going on at our DMV. We had our DMV open, but at the same time, as I understood, our doors were locked, and we had people come up, knock on the door, and we let people in, but we're trying to keep that distancing and everything. Well, what we're doing now is we're changing that to where we're going to have 6 people in there at a time, and as those 6 people, you know, as one rotates out, one can rotate in, and so if you've got an issue and you need to come to DMV, please come. In regard to the Brook Power Plant that's going on up there, there's some controversy there and all that kind of stuff. I want to just go back and just clarify my position. My position is just this, I've directed Secretary Gaunch to have the West Virginia Economic Development Authority to review their application again, and I'm going to go with the Economic Development Authority's decision upon their review. However, here would be my direction, and it would be just this. First of all, it has been said that the gas, if this plant were ever built, the gas would be coming in a pipeline that they would build into Pennsylvania. That won't work. The gas has got to come from West Virginia. The other thing is, the hiring of the people needs to be at least 75% West Virginia workforce. The hiring of the subcontractors needs to be the same, some level of the same type of participation where we weigh it heavily towards West Virginia. Now, the biggest thing and the biggest problem that I have about this whole thing is just this. From the state guaranteeing something that it looks to me like that they've been trying to raise these dollars for 8 or 9 years, and very frankly, I have very, very serious doubt that will ever happen. And so from the standpoint of our EDA, I want them to go back and get some level of assurance that they will truly be able to raise the monies, Before somebody comes to us and starts asking for money, at least we should have some level of assurance that the business is viable and that things are going to truly happen. And it's going to be of significant benefit to West Virginia. Now, if I didn't have the right to ask those questions, then I must not be much of a governor. Because naturally, any of us would welcome construction and welcome things to come to the state of West Virginia if we felt like that it was real and we felt like that it wouldn't hurt our other people, So at the same time, we want to look at generation demand. We want to look at many different aspects of this and make the right decision, the very, very best decision for West Virginia. So I'm going to pass all those comments back to EDA. And the number one thing is just this. I don't see how in the world that you can come to the state of West Virginia and start asking the state of West Virginia to underwrite certain things if we can't be convinced that you can raise the money. And and I'm surely not convinced, and I don't know about our EDA, but our EDA should do the job, and I'm going to depend on them to do that job. From the standpoint of our small business grants, they're going along fine. We need more and more people to apply. We're trying to help with our small businesses in every way we possibly can every day. We've got $95 million, right at $95 million that's been awarded to our cities and our counties. We still got a long ways to go, but let's continue to have those people apply, and we'll continue to send that money towards our cities and our counties. From our free testing this week, we're going to be in Logan, Fayette, and Jackson counties, but in addition to that, we're also going to be in the counties, absolutely, that we're going to be in Logan and Fayette, and we need to be in Kanawha County as well, because we want to tie our testing to being able not only to test the athletes and the bands and all that kind of stuff, but we want to be able to offer additional testing in those counties that are orange so that we can get them out of orange and get them some way into the yellow and the green and going the right way, because we want those kids to be able to come back to school. So our feeding program, if you got a problem, call 211. There's 696 sites. We don't want any West Virginian going hungry. And now we're up to 92.9% counted residents so far in West Virginia. It's great. We're still second. Idaho's at 96.5. We're closing in on them. We're barely ahead of Washington. We got till September the 30th. We need one more strong push, and we'll get there, West Virginia. But the long and the short of just this is just one thing. And I want everybody to really listen to me. In regard to us playing games, in regard to the public health, in regard to every aspect of what we're doing from the standpoint of all the economics to everything that's going on, you got a lot of really good people that are really helping me, and we're trying with all in us to try to help our kids to be able to enjoy sports, to get back to school, to have our schools be safe. We're trying every way within us to deal with this pandemic that nobody has ever dealt with. They're in a playbook here, and everybody here is absolutely pulling the rope as hard as we can. But let me tell you, and please listen to these words, the second we become divided, and there's people that think, well, we ought to get a play, or this group says, no, we shouldn't do this, or this group says, we ought to do this, and this group says we ought to do that. As soon as we get there, we will become Florida or Texas. We will become divided, and our unified effort that has provided us with this miracle has got to continue. And to do that, we as West Virginians need to stay all in the boat together, pulling the rope as best we possibly can, because as soon as you start trying to push a rope, it's not going to work. And so I would urge each and every one of you to continue to know that this is tough stuff. It's tough on lots of families. It's tough on lots of individuals. It's tough on all the people that are trying to make the right decisions. We're going to continue to do so. We're not going to be pressured by anybody, standing and hollering outside or whatever it may be. That's not going to be the right answer. We're going to do the very, very best we can do. We've got a week, and then our kids have to be back in school. Now, we got a week. Let's use the tool that is right in front of us to be able to test all these kids and all the stuff in the communities where the communities are orange. Let's do some significant testing that will give us even more information. And let's hope and pray that every single last one of them tests negative and we're on our way out of this orange situation. And if they do test positive, at least we'll know and we can direct and really help get out of the orange situation instead of them being spreaders that can go and create more and more and more havoc. So nevertheless, that's all I've got, and I'll go back to Jordan.
All right, thank you, Governor. Let's first today go to Clayton Birch, our West Virginia Superintendent of Schools.
Thank you. Good afternoon. So a few updates today. I'll be brief. First and foremost, I'll reiterate what the governor said, is that we have 1 week. My eyes are still on Saturday, September 5th, and the goal has always been to have as many, if not all, counties in green or yellows that we can open. We're still trending as a state. Over 70% of the families have opted to be in person. We know that we've given each and every families across the state an option of in-person and virtual. And I continue to stress that those children where their parents have chose to be in person need the schools to open for a variety of reasons. It is very, very important to these young people and that these schools open. So with the governor's announcement today, I absolutely am 100% behind the governor that if we can do anything in our power to trend or assist any of these counties in moving back to green or yellow by Saturday. And if that means testing, if that means using sports as a leverage to really give an opportunity, I'm in. I'm 100% in. We have got to get these counties to green or yellow by Saturday. I cannot stress enough, we are 5 days and counting, and we are watching the numbers each and every day. So, Governor, I appreciate anything we can do to get to green or yellow. Second, I do have an announcement to make. It's a reiteration from Friday. Just want to continue encouraging all of our teachers out there to communicate to your principals or your county school systems. Our surveys with the superintendents came back on all supplies and needed items. We actually had an opportunity to talk to several of them Friday afternoon, and that went very, very well. Then we heard the announcement that Highmark was going to be donating a packet to each and every classroom for mask, additional sanitizer, and I'm going to announce today that we are now in the process of triple checking that every classroom has the supplies they need. Our offices are reaching out to all of the principals just to triple check that those supplies are there and ready. So I cannot thank our principals, superintendents, and others enough, and I encourage each and every teacher, please continue communicating to your principal, your school leadership, if you need anything at all. We have a lot of folks here willing to help. Thank you.
All right, thank you, Superintendent. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's a pleasure to be with everyone today. I want to reiterate a few things the governor said, and then I'd like to expand on this just a little bit. So, as Superintendent Birch and the governor said, we have a week to try to get our students back in school, but more importantly, we have this week and then the weeks following to try to create healthy communities where it's not only safe for our children and our teachers to go back to school, but where it's safe for people to go back to businesses, where we can start to enjoy the activities that the governor articulated as a coach. And I would say as a parent of 3 children that played sports all the way through high school and 1 through college, that there is a lot of joy, there's a lot of important lessons to be learned, a lot of discipline, teamwork, resilience that is learned on the playing field. But I think that the key is that this is not about trying to help student athletes get back on the playing field. This is about trying to help communities get healthy. We know that the secret to our success to date, as the governor said, is staying together. And we also know that extensive testing has allowed us to identify people who are asymptomatic or pre-symptomatic so that we can control the rate of COVID spread in West Virginia. We see what happens when COVID spreads and spreads to rural counties. We see people dying now at a rate that's faster than we've seen before, our most vulnerable, just like the Kaiser Family Foundation feared, that we would have the potential to have a lot of deaths because of the population and the comorbidities that we have. We're seeing that. We're also seeing, as we're trying to get back to school, as we're trying to get back to the life that we want, that we're seeing counties that are coming up orange. And orange, as you remember, by our coding map and by the Harvard Global Health Institute's map, means that you have a high incidence of community spread that is adjusted for 100,000 population. And we think of green and yellow as one set of colors and orange and red as another. And when you're red, then you can't have in-person education. You can't have activities because you're in the danger zone. And orange is pre-danger zone. So anything that we can do to get our communities back in the green and yellow, this is a time to do it. And this testing will help a lot. We know that the number of children under 18 has almost doubled in the last month and a half. And we know that children that are under 18 that get infected with COVID, that get sick, are just as likely as adults that get sick who are admitted to the hospital to go to the ICU. We know we have a child today in West Virginia who is recovering from the multi-system inflammatory syndrome in children that can be life-threatening. So this is West Virginia, where we come together and we do the work that we need to do, not only to allow our students to be on the athletic fields, but to allow our students and teachers to safely go back to school. And I would implore each one of you that not only will we test more, and please show up for that testing, but we also want you to redouble your efforts to wear a mask, to physically distance, to stay home if you're sick, to cover your coughs and sneezes, to wash your hands, to do the things that protect yourself and protect each other, because we are seeing now at the very front end of the hardest thing that we've done so far in West Virginia, which is open the schools. We have seen that we have several counties already in the orange, and we can't start school in the orange. So it's time, West Virginia, to show your passion, to show your love for each other, to show your altruism, and to show your concern for our children and for our teachers and for our schools, to really double down and show the country why you've been the beacon so far. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Scott Adkins, the Acting Director of Workforce West Virginia.
Thanks, Jordan, and good afternoon. As Governor Justice mentioned during the press briefing on Friday, West Virginia received $68.3 million from FEMA as part of the President's executive orders signed on August 8th. The $68.3 million will cover 3 weeks of the extra $300 for individuals meeting the FEMA eligibility requirements. Every week, West Virginia Workforce will request additional funding from FEMA to cover the following week's expenses. To help further ease the financial burden on unemployed West Virginians, Governor Justice has directed Workforce to add an extra $100 for a total of $400 weekly for those folks who meet the FEMA eligibility requirements. FEMA eligible individuals will receive the extra $400, as Governor Justice mentioned earlier, for the weeks ending August the 1st, August the 8th, and August the 15th initially. Individuals returning to work or exhausting their unemployment benefits prior to the week ending August the 1st will not be eligible for the Lost Wages Assistance Program. So if your benefits expired, say July the 24th, July the 23rd, you won't be eligible for the extra $400. FEMA has set aside $44 billion to cover these expenses across the country. FEMA has made it clear that when those $44 billion are gone, and there's some other criteria involved as well, then the benefits for the low wages assistance program will come to an end. Now, let's talk about eligibility and how you qualify. To qualify for the full $400, you must be eligible for some form of unemployment and have at least $100 in weekly benefits. So it could be a program under the CARES Act, it could be regular state unemployment, but you have to have a $100 weekly benefit eligibility to meet the requirements from FEMA. Now, the folks who don't meet that eligibility, the $100 weekly benefit amount, Governor Justice has directed Workforce to include the extra $100 for those folks now. So we have about 15,000 people in our system currently receiving unemployment benefits. Those folks will be eligible not for the full $400, but they'll get the weekly benefit amount plus $100. Now, claimants, the other certification piece, claimants will be required to self-certify that they're unemployed or partially unemployed due to the disruptions caused by COVID-19. If you're on PUA, an independent contractor, self-employed, that question is already on your weekly recertifications. You don't need to do anything at all. In the coming weeks, that same question will be added to the regular UI claimants, or if you're on the extended benefits, that question will also be on your weekly certification. So you don't need to do anything extra. There's not an application. Just continue to complete those weekly certifications on Sunday. Workforce understands, and Governor Justice has directed Workforce to pull out all stops, to allocate all resources, pull in vendors when necessary. We're working with other states. We're also working with FEMA and USDOL to make sure that we accurately pay folks as quickly as we can. And so we know it's critical to a lot of West Virginians. And I can assure you, under Governor Justice's leadership and direction, Workforce is doing everything we can to get those benefits out as quickly as possible. Thank you.
Thank you, Director. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. We continue a significant amount of support to the Bureau of Public Health as we work with them on the initiatives at a variety of nursing homes that the governor pointed out. We continue to address and mitigate spread in those nursing homes. Test lanes, as mentioned by the governor, will be going on all this week. In addition to that, a number of sanitization missions continue in place to include a quick reaction response this weekend to support the Clay County Sheriff's Office in order to clean facilities to allow for payrolls to be made this week. Thank you.
All right, thank you, General. We have Bernie Dolan, Executive Director of the WVSSAC, Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer, also joining us today, and they are all available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with Channel 8 and Fox 11.
Thank you. Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I don't know exactly who to ask this, maybe the governor, or maybe you'll defer to Superintendent Birch, but there was some glitching and tweaking and some color changing that people have been very concerned about on the map, which was due to be posted Saturday night at 9 p.m. As difficult as it is to get government to operate sometimes because it's so big and it's such a massive problem, but to meet that 9 p.m. deadline and to have everything ready to go and have your ducks in a row, can we be assured that this Saturday at 9 p.m., we will have a final completed map, which will accurately show what the situation will be for the next week when schools will be opening? It seems like that's a pretty critical thing that has to happen. Thank you.
Let me lead off, and then I'll pass to Clayton, okay? Kenny, good question. You know, while we surely have had all hands on deck, by coming out on Saturday night, which we think is the best time to come out, what is the most convenient for all those that are involved, it becomes problematic from the standpoint of government shutting down at 4 o'clock or whenever on Friday, and and issues through the Saturday and making sure and double checking and everything. But I'm going to now pass to Clayton. You have identified, no question, that there's problems. And you've identified there's no question that the great part about what we've done is now we've done it. And we've done it one time. And now we got this week, and this week to really, really help us fine-tune and make absolutely certain that we're dead on the money right. Plus the fact that it gives us the ability to now, through this testing tweak and everything, it gives us the ability to add a really health component that will give us the ability to motivate these counties and get them out of the orange where we can get our kids back in school, which is by far the most important. So I'll pass to Clayton on that, but I'm really, really glad that we came out on this Saturday like we did. I am so happy that Bernie moved everything from the standpoint of allowing athletics to start the week before, because that really helps us now, because now we're not just coming out right out of the get-go with something that will impact the schools from opening up. But Clayton.
Thank you, Governor Kinney. That's actually a great question. I can assure you that we have made it clear to the governor that on Saturday at 9 o'clock we will be ready, working with our health officials, and I know Clay Marsh may want to add to this, but we want to make sure that everything is in order. And sometimes working on that 9 o'clock deadline we thought was going to be tough, but I believe we now have a much, much better idea how to make that. And I'll echo the thanks to Bernie Dolan and the SSAC. You got to be the almost the practice run with that.
Governor, do you mind if I make that?
No, go ahead.
So Kenny, I would also just say that the efforts of the whole health team has been to make sure that these data are correct. And so that, as we went through the first rendition, we've learned about the timing of things when we need to make sure that we have the expert panel start to make any comments and finalize things. So, as was said before, we are always learning and we are always wanting to get better. This was the first run of this system, which I am actually really convinced, even more after this weekend, is a system that is the right system for West Virginia, not only to delineate these color-coded threshold risk categories for the counties, but also to provide an internal incentive, because we really want this to serve not only to adjust the opening of the schools and the playing of sports and other activities, but really as an incentive to enhance community health. And so as we go forward, we will make the necessary adjustments so that it will be, smooth next week. But I think it's important to make sure that everybody who is listening out there recognizes that the critical issue for us last week, this week, next week, the following week, is to be accurate and make sure that we're right about what we are making the calls on. But we will adjust the time so that we are able to do this more expeditiously and make sure that by 9 o'clock it is ready to roll.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. And going back to the Brooke County Power Project, I know that you had specifically mentioned that there are questions that you and the state would like to see answered. I know a couple of those questions I feel like have been answered. I think on the PSC application, I thought Brooke County Power had said that they had planned to hire 75% of their workforce from West Virginia. And then as far as the natural gas pipeline from Pennsylvania, I understand that's connecting the plant into the Rover pipeline, which of course also goes into West Virginia, particularly Tyler and Doddridge counties. So it would ultimately, they believe, the project people believe, would create more of a demand for West Virginia natural gas production in those counties. Are you saying that there still needs to be some more clarity on those particular issues? Thank you.
Stephen, I'm just saying, the way this thing was presented to me right off the get-go was just this. It was presented to me 2.5 or 3 weeks ago. And when it came to me with a pipeline going into Pennsylvania and bringing the gas out of Pennsylvania. It came to me without the assurances really of that the workforce would be primarily driven by West Virginia. And it came to me with a really big doubt about whether or not it is viable and whether or not we have checked, from the standpoint of the need for generation or whatever it may be. But the biggest thing is, can they raise the money? Now, so from all that, it's taken me a couple of weeks to pose all the questions back to the EDA and let them now do their job. But I just needed, once I got it and it came rolling across my desk, I wanted those questions answered, because I sure to goodness don't want us to go up there and build something, if they can raise the money, that will absolutely, adversely impact us and us not derive benefit. And the benefit primarily is the gas has to come from here, the workers have to come from here, and so for me, it's a straightforward, real simple thing. I am for doing anything and everything I can to perpetuate our natural gas and our petrochemical industries within the state, but I want to do so that it's just a smart move for the state, and that's why we've taken this time. Now it's back in the EDA's hands, and we'll see where they go with it.
All right, thank you, Steve. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. According to DHHR's map, Mon County has also gone orange since Saturday's map was put out. Do we plan on making the same sort of exceptions and testing preparations for student athletes there? And how can we justify reopening bars in an orange county? Thank you.
Charles, from my standpoint, we set on the bars, and then I'm gonna pass to Clayton, in regard to Mon County moving orange. Mon County, as of Saturday night, was in the yellow, so they are eligible to play. As far as doing additional testing in Mon County, we're going to do that. We're going to move to Mon County right now. Because any of the counties that have moved in the orange, we absolutely want to move to those counties to assist them to be able to get them in the yellow, and then and be able to do that and get them in the yellow or the green so they can go back to school. And as far as the bars go and everything, that decision was made when our numbers were coming down. The decision was made 18 days ago. That we said on August 31st, we're going to do this. We at that time, we bought us, we went through 10 days, and then 7 days, and then we took 11 days. And so now, now we're set, and that decision was made while we're in the yellow. If in fact, what we do is this Mon County situation still trends in the orange, if we have to go back to shutting back down, we shut back down. But back to Clayton or to Clay. To Clay.
Yeah.
Thank you, Governor. I think that one of the things that's really important to recognize is that in counties with universities or large colleges, it becomes really challenging for those counties, because we know that the preparation that's been taken by the colleges and the universities in West Virginia has been really exemplary. Certainly Chancellor Tucker and HEPC, along with the presidents of our universities, have taken exceptional care to try to provide a safe environment for our students. And West Virginia University, being our largest university located in Mon County, has done extensive amounts of tested in the 20,000+ range. And so as we have identified people in that testing, students who have tested positive at about 1% incidence rate of all students tested to those tested positive, are going to add cases against that county's population, which is, the county's about 109,000 population, as I remember, is going to make that county inflate their numbers relatively quickly. And so one of the things that we're doing, certainly working with the university leadership and the county leadership, is trying to continue to practice those mitigation measures and mask wearing and physical distancing. But this is also an area where we're constantly watching with our expert panel, because we realize that while the population of the county, the denominator changes because of the great number of tests that have been performed in that county to repatriate all the students, that we were almost by definition going to pick up more positive cases, which is going to push the county into that orange range. So this is one of the reasons why we have this expert panel, to be able to identify sort of those nuances that will affect the color coding of the county. But suffice it to say that Mon County, with the students back, is constantly at risk of having those cases go up because of the spread between young people, which we've seen all over the country as well as seen in West Virginia.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. My question probably be best answered by the Governor, General Hoyer, and Dr. Marsh. I'm concerned about the situation in Fayette County with Mount Olive, with 138 positive tests. You must be concerned about workers there taking it back and spreading it into the community. That's a lot of cases. So I'm wondering what you're doing in terms of contact tracing and prevention efforts, and trying to keep an eye, and testing as well, in the surrounding community around Mount Olive, as well as the sanitation of that prison facility.
Mark, I think really and true, General Hoyer or Secretary Crouch, could answer this better than Clay or myself.
So, Governor, I could cover the work we're doing with the Department of Corrections. National Guard is in regular contact with Commissioner Jivenin and her staff at the Department of Corrections, working on the things that they need support from us, to include scheduling sanitization missions. There's actually currently a mission scheduled this week for one of our regional jails here in Kanawha County. We're also working with them on availability of PPE and other things, and Secretary Crouch may be able to cover anything related to the work they're doing in Bureau of Public Health with corrections on contact tracing.
Hi, Mark. Sure. We're still waiting on about 187 more tests that are pending. And as far as the numbers go at Mount Olive, we have 140 inmates, 15 staff, 527 inmates are negative, and I think I said 187 tests are pending. As soon as we have the rest of those, which should be about today, I would assume, then we're going to have the National Guard figure out when they need to do any cleanup efforts. But we talk to Commissioner Jivenin daily, if not 2 or 3 times a day, and contact tracing is taken care of by the Fayette County Local Health Department. But we do keep an eye on the corrections facilities every single day and keeping up to date. But the contact tracing is being done by the local health department.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Thanks for making time. Good afternoon, panel. And I'm glad Bernie's on the call today. Bernie, what are you telling schools about attendance at games in the coming week and I guess for the season? And what about press boxes and things like that? How are you directing the schools on how to handle that?
Okay, thanks for the question. We're telling the schools, attendance-wise, we're trying to keep it in the household and making sure that it limits our contacts at this point. Every player, cheerleader, band member, if they're in yellow, their parents get to come. If they're in green, they all get to come, everybody in the household. And we think that that's the most prudent thing to do, to make sure that, we try to keep everybody as separate as possible. if the players are clean and the families are clean, they should be able to be in the stands together and not be an issue. As far as the press box, we've told they should limit to essential personnel in the press box, and I would send media. Our guidance has been send media to the sidelines. Not very many press boxes have enough room to really socially distance and do all the clock operating and everything else that you do. So that's been our guidance for that. We have told everybody we're going to revisit the attendance as we move forward. This past week, we've had scrimmages, and with the restrictions we've had, there's a lot of new protocol for our schools, and they have worked on it to try to master it so that people get in and get out efficiently and sit in a socially distant manner. So I think this week went well, and we're looking forward to the first week.
All right, thank you, Paul. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, all. This is Emily Allen with Public Broadcasting. My question is about the testing of all athletes. I know the CDC kind of walked back its asymptomatic guidance, but are we concerned about testing lags there? I know nursing homes in general, sometimes it feels too long to get their results back. Like, when do we expect to get these students' results back, and what kind of difference are we scared it might make in waiting for results in other important settings like nursing homes and correctional facilities and so on?
You want to go with that? Okay.
Thank you, Emily, for the question. And I will start, and then Bill, Bill Crouch, if you want to add anything in. So we are using this as a single week opportunity to try to help get communities fit and prepared and eligible to open schools and to try to improve community health. We are highly cognizant that the time frame of delivering any tests back is a challenge for us, and we have worked with a few organizations to try to make sure that these particular tests are returned on a rapid turnaround, not only because that will impact the ability of the teams to schedule to play, the teams that would be eligible after testing, but also so that we can prepare the communities and the schools for the ability to get back into classrooms. So as we go forward, this focus testing should not affect our ability to test in other areas or the rapidity of the turnaround of tests in other areas. But certainly we are going to focus testing on the students, the coaches, the bands, the cheerleaders, other people involved with these participatory sports, but also of other members of these communities, because these communities right now have been identified by our public health sector as our more hotspot communities. And so, as the governor has always said, we run to the fire when we see these hotspot communities, and that's what we're doing here to try to make sure that we identify the people that might be asymptomatic or pre-symptomatic so that we can isolate them, do the appropriate contact tracing, and try to make these communities safer and better, control the spread of COVID so that we can open up our schools safely for our students and our teachers. Bill, I don't know if you have any other comments.
Thank you, Clay, and thank you, Emily. That's a great question. We've had several discussions already with regard to that. Outbreaks are the priority, and we're doing this with many several of our new labs. We talked about adding 3 labs last week, so we're using this as an opportunity to use these labs first for the students while we continue the outbreak testing with our existing labs. So it's a good time for us to do this and not interrupt outbreak testing. That's important, and it's going to continue, and it remains a priority. We give nursing homes priority in these testing with these labs and ask them to make outbreaks in nursing homes a priority. So we're adjusting as we go along here in terms of the information and how we do these. This is a little new, but we're going to get it done and make sure we get our students out on the field as quickly as possible.
All right, thank you, Emily. Next, we'll go to Rodney Lamp with WBOY.
Hi, Governor. I just have a question about the county alert system. I'm looking at it here, and it's 7-day rolling average for the larger counties, 14 days for the smaller ones. And I'm looking at Montague County. It's in orange, and it says the average rate is 10.01. However, that's the figure for August 30th. If you look at the 7-day average, it's only 8.71, which would put Mon County in the yellow. So I'm just wanting some clarification on how exactly the color system is working with this map.
Okay, I think Secretary Crouch is going to have to go back and answer that and everything. And again, and I think Dr. Marsh said it just perfect, and maybe I said too, but the beauty of what has happened here with this first week is that it's not a week reflecting going back in school. And if you'll just step back from this whole thing and say, I really believe that the good Lord moves in our lives and tells us what to do, and everything is happening all around us. But just think about this. We go out with the map, and then we want to some way, somehow, find a way that we can maybe allow our kids to participate, because what we really want to have happen more than anything is we want to get these counties down out of the orange into the yellow and the green to be able to go back to school, because school is everything. And so in all of that, that leads us to an idea that says, let's test all of our athletes. Let's test the band. Let's test the staff. Let's test everybody. Let's test everybody here that is associated with these schools that are in the orange, in the counties in the orange. And then where does that lead us? It leads us to DAG. This will absolutely give us a ton more information. It will assist these counties in every way to move them from the orange down into yellow and the green. It's exactly what we want to accomplish. Granted. And then the other thing that this run out did is it tells us any quirks that we have in the system that we can make better. Now, this may be a quirk in the system that we need to make better, but by the run out now and in what we're doing, I love it, because it's given us more information, more good ideas, more testing, more information, more motivation to get our counties down and perfect what we're doing. So, Bill, if you've got something else in regard to that, please share it.
Yes, sir, Governor. Let me talk about the timeline a little bit. I talked about that Friday, and the timeline is the day before, and it is midnight of last night that data was used to make the calculation. So that's why you see the date there of August 30th. We're looking at this, as the governor said. It's been an experience kind of going through the weekend and making sure our data is we investigate that 2 or 3 times now. We're going to fine tune this as we go forward. It is very easy to kind of get lost in these numbers sometimes. But if you look at the active cases under the 7-day trend for Montague County, that's increased to 109. So those cases have been creeping up a little bit over the weekend, and that's why they went right over the line at 10.1 or 10.01. That's why they ended up orange just barely. We have a similar situation in Kanawha County where they were orange 4 out of 5 days, but they're right below 10 or right above 10. They've ended up being more consistently in the orange. So the way that those numbers come down are to get folks to wear masks and to get folks to socially distance and to try to do what needs to be done to hold that community spread down. So we're seeing more outbreaks throughout the state. We're seeing more outbreaks in Montague County and in Kanawha County. But we will talk more about the numbers as we go forward. Again, we're trying to be very transparent in how we do this and what we do to make those calculations. But Montague was based upon yesterday's numbers, they are slightly over 10.
All right, thank you, Rodney. Next, we'll go to Amanda Barron with WSAZ.
Hi, everybody. Amanda Barron with WSAZ. Hope you're having a good start to the week. My question is about the sustainability of testing when it comes to the student athletes. I know, as I understand it, and I could be wrong, that it's only going to be a one-time thing for the schools or the counties in the orange. Do you worry about what happens next week when there are inevitably schools in the orange and those students want the same treatment?
Okay, Amanda, I do worry. I think that's been, an opinion that has been, offered up over and over. I think, I think Bernie worries, Clayton worries, Clay worries, Jim worries. Everybody worries about this, but we've got to understand that this is really an exception. You see, the number one thing we want to do is get our kids the opportunity to be able to go back to school. And so with all of that, now we got a week. But we also know that we do not have the capabilities. We don't have the capabilities to be able to test. What if we have multiple counties that pop up in the orange and everybody says, well, we want to play and we want the same, the same thing that happened in the beginning. All we're doing is we are absolutely trying to perfect the system, and we've got a week to do so. Now, as we perfect the system, we got to go with it. And we got to tell everybody right now, and you've got to listen to me. I'm not going to be able to help you. I'm not going to be able to help you. When our health experts and our powers to be put our maps together from this point forward, they are what they are. We just have a golden opportunity with this week being able to play sports and not worry about being back in school, and absolutely be able to use this as a vehicle to get us down out of the orange in those counties and hopefully get us into the green and the yellow.
All right, thank you, Amanda. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. First of all, Governor, the opportunity to apologize to the people of West Virginia still stands. Secondly, as I understand the Harvard Global risk map, it applies to all elements of society. If you get into a red, then you have a shutdown, stay-at-home orders put back in place. What's the point of having a risk map if it only applies to, at this point, schools and nursing homes? And also, what's the point of having a risk map if you keep making exceptions to say, well, this is orange, but we can play football and it's orange, but we can still reopen the bars?
Phil, I mean, my dad used to say all the time, Phil, if you're working really hard and you're doing a construction job or whatever like that, and you're running a bulldozer and you got the bulldozer hung up, that's okay because you're working really, really hard. But for God's sakes a living, don't go get another bulldozer and get them both hung up. Phil, I'm not the person that made fun of our service personnel here and went out on Twitter and did that in a public way, humiliating the good people that were working here at our state capitol. You were the one that did that, Phil. And then you were the one that came on and crying, said, I am so sorry, I am so sorry, I'm so sorry. And yet, then when I started talking about a foster child kid, 7-year-old, a 7-year-old foster kid, you absolutely, after being suspended from your job, you absolutely then attacked our foster care system. Now, Phil, you did that, not me. I'm the one that came out after you were crying and said you were so sorry. I'm the one that came out and said, it takes a big guy to do that and we should forgive and go on down the road. I'm not the guy that beat on this and brought this up and so-called in your mind, said that your employer should get rid of you and tried to advocate getting rid of you. I'm not the one that did that, Phil. I mean, for crying out loud, just look in the mirror and you'll figure out who did that. Now, at the end of the day, all we're doing in moving forward and tweaking and making moves and everything on the chessboard to try to make things better, All we're doing is trying to make things better. And Phil, when you attack and say, and you scan everything, just looking for something bad, that's not what a journalist does. You just scan and scan and scan, and then you come up and say, the small business, nudist colony or something like that apply. I'm not one to judge. Neither are you, Phil. If they're businesses and they pass the process, I'm not one to judge. And surely to God above, neither are you. And so I'm going to pass the other part of the equation to. Did anybody hear the end of the end?
It was so. Phil, can you just repeat the part of the question? I do remember the Mon County Bar part, but what was the other part that you articulated?
Well, I think what I was saying is Harvard Global seems to apply to all aspects of society, and we've narrowed down that risk management to just schools and nursing homes, and then at that point we even make exceptions to say if you're orange, you can play sports if you do this, and if you're orange, the bars can still reopen.
If I could, Governor, you good with me to go?
No, but let me just say this. We made the move on the bars as an August 31st a date, and we told these people that they'd be able to reopen at that point in time, and Mon County has stayed yellow, and then all of a sudden this morning, Mon County turns back orange. Well, we can't pivot to these people and just say, nope, it can't be open now, but we can watch, and if the numbers start to move in a negative way, we'll shut them back down.
Yeah, and I would just say simply that, we have modified the Harvard Global Health Institute's approach. Instead of measuring all new cases equally, and that would be community spread and congregate spread, that we have moved to really focusing on community spread. And the reason why we've done that is because community spread is really how we will see the numbers, the incidence rates, the new cases go up in all of our communities. And as we look at this sort of navigation for the first week, as we've talked about testing some of our children, our student athletes and other participants, band members, cheerleaders, then we are also testing a demographic group that will be back in schools and who could spread if they were asymptomatic, infected people or pre-symptomatic, they could spread to other people. So I think that the modifications that we're making, as the governor said, as Dr. Birx said, and others, and we've said here many times, there's no playbook for this. We are actively trying to create the best approach, the safest approach for the people of West Virginia. And we see that COVID has invaded the rural parts of our state with more vulnerable people. So it is really important for us, Phil, in my opinion, not just for the athletics and the schools, but really for all communities, because we want to save lives. We want to promote health and well-being, and the governor's done that consistently. So we continue to try to approach this in a way where we can reach that end goal in the most expeditious way possible. And so I think that these approaches that you see are in many ways creative approaches that we are utilizing with the benefit of all the experts that we can reach out to, both here in West Virginia, nationally, internationally, to give our citizens the best opportunity to get through this in the safest, best way to continue to protect their health and well-being.
All right, thank you, Phil. Next, we'll go to Annie Moore with WVVA.
Good afternoon, Governor. With at least one hospital in southern West Virginia, Mercer County, having to go on diversion recently, is there any concern over bed space and hospital capacity in the southern half of the state?
I think Dr. Amjad or Clay, maybe Dr. Amjad can answer that better than I can.
Hi, Annie. As far as I know, I talked to one of the doctors down in Mercer County, who's actually the health officer the other day, and he stated as that they're not in diversion. This was just a couple of days ago, Dr. Stefaniak. But bed capacity right now is not an issue. I think Kanawha County is having some issues because of the nursing home outbreak, but we're doing okay. We look at the daily capacity report every day. Also, General Hoyer looks at that. We look at that and talk about it, but we're actively looking at that case. But I know Mercer County was having issues a couple of days ago, but we touched base and talk about it. So right now we're doing okay. I don't know if General Hoyer has any updates, but we're looking at that actively.
Yes, Annie, working with Bureau of Public Health and the Hospital Association, National Guard, along with those two, track data daily. The Hospital Association has now broken that data down even further. We do not see any significant challenges at this time with hospital bed capacity as well as ICU or ventilator capacity.
All right, thank you, Annie. Our last question today comes from Aaron Beck with 100 Days in Appalachia.
Hi, Governor. According to, can you hear me?
Yes, we can.
Okay. According to a letter sent to your senior staff on August 18th, foster parents are not being given the final say about school choices for children in their homes. Many report being left out of the decision-making process, and some have been forced to have children removed from their homes because of decisions that were made without their input. What are you doing to address this problem?
I think, Bill, we got to come back to you, Secretary Crouch.
Yes, sir, Governor. Hi, Aaron. Yes, the multiple disciplinary teams are responsible for making those decisions. The decision to use those teams as the vehicle to make the decisions was so that all individuals working in the best interest of the child could be heard. The MDT includes a broader group of stakeholders, including the foster children, foster parents, and biological parents where appropriate. So through the guidance, we've made clear that the key participant in this process is the foster parents. And it was also made clear that special consideration should be made to the foster parents' ability to accommodate and support school options. So this is a difficult time with regard to a pandemic, and we have children who are living with kinship placement and with grandparents. So we're trying to make sure everybody's heard through this process. These decisions are made in order to support the child and the foster parents. And for instance, for example, if a foster parent cannot accommodate a virtual school setting, that option is in the best interest of the child, then the MDT must be able to identify a supportive adult who can help the child and continue to still be with the foster parents. So the goal is to ensure that foster parents' education needs are addressed and resources identified to ensure that they have what is needed to be successful. So we're working very hard to try to make sure foster parents' voice is heard in this to the greatest extent possible. But the overriding responsibility here is to make sure the child gets back into school. It is very important that foster children who have not been in school get back into that environment. So we've gone through this process now for several weeks and have had very few problems with the process. So we are monitoring that, and we're trying to make sure that it works well.
All right, thank you, Aaron. We'll now go to Brian Abraham, the Governor's General Counsel, for an additional comment.
Thank you. We've had several inquiries about our executive orders and our guidelines. To date, we've issued 63 executive orders that are related to COVID. We can't include every level of detail in the executive order for various reasons, most often of which is the timing required when we do the filing. So we issue guidelines whose purpose is to define intent or clarify the executive order. It's the intent of the Office of the Governor that both the guidelines and the executive order should be read together to give full purpose and effect. Similar to this would be our West Virginia Code and our rules that our agencies make. All of the language in the executive order and the guidelines should be read together to understand the purpose and the effect of both. As always, our office will work and assist with anyone who has any questions. All you have to do is contact the Governor's legal office, and we'll be happy to provide any information we can.
Great, thank you. Brian, Governor, I'll turn it back to you.
Okay, I'm gonna pass back to Clayton in just one second here, but I want to say two or three things. First of all, as far as the athletes, all those that are participating in any of the sports, band, no matter cheerleading, whatever it may be, all that testing will be free to those participants and everything, and Superintendent Birch will be giving us some guidelines in just one second on all that. Like I said over and over to you today, that this is a one-time deal, but beyond this, and the purpose of the one-time deal is to be able to help us in these counties be able to get back down to where we can get back to school, or we can go to school. We can start and not start our kids behind. I think that makes all the sense in the world. I want to say this, and this kind of gets, maybe missed or swept under the rug a little bit, but you go back to the SSAC and think about what Bernie and his staff and all of them have done. If you go back in time and look, back in the summer, we went through a coaching period, a conditioning period, a contact period, or a distancing period, and then more of a conditioning period. Now we've gone into a ramp up to where we've gone into a scrimmage situation. And I really and truly, let's just step back and give credit where credit's due. And now we're getting ready to compete. In fact, we're already started competing, whether it be in golf or volleyball or whatever like that. But they've done, I don't know of an incident. There probably is something somewhere, but really and truly, it's been a heck of a job, and it's a whole lot of moving parts. And so give credit where credit's due. SSAC is doing great work there. Now, I guess I'm going to pass, and Clayton is going to end up with a couple things, but go ahead, Clayton.
Yeah, thank you, Governor. So a couple clarifications I want to put out there. First and foremost, let's talk about the testing for today. Everybody is moving very, very fast to make this happen. The SSAC, the local health departments, DHHR have all been on a call with the principals, and the principals are going to be communicating directly with the coaches. So we're going to have a very, very straightforward communication protocol right down to the participants and the players. So you're going to hear from your coaches today. They're going to tell you exactly what time your testing will be at your school, and the goal is to have those testing lanes at the school. We're going to make this very, very straightforward, very easy, and we're going to rely on our principals and coaches to help us communicate directly with you if you need to be tested as an athlete, as well as band and anybody participating in any activity this week. So thank you for everybody making that happen so fast. It's amazing. The other clarification I want to give is something that's popped up on a few of our responses. Folks have written in. It's been an inquiry, and the map is really, really important for the health of our communities. The map was to drive decisions about school. The map was to drive decisions about community spread, how to mitigate as you moved up. So the question's been posed a couple times. What if a county decided to go full remote learning on their own, which means they're green or yellow, they should be opening, and on their own, they decide to go full remote? And I just want to be very, very clear that by default, they would be choosing not to open up school and not to give an option to the families. We know that over 70% of the families have asked for in-person, so we really, really need the schools to open up for those children. There's also some word about if full remote would be allowed to play sports, and the answer would be no. We've got to have children in the buildings. It's got to be safe to open up. And we know that after speaking to Trish Lucas, the superintendent of Logan County, everybody's asked, well, Logan County voted to go full remote. I think they were doing the right thing, making a local decision. They wanted to get ahead of it because their numbers were so bad. But in conversations with Trish Lucas and those leadership folks down there, they absolutely would reconsider that if they turn green or yellow. They want nothing more than those students to be back in school also. So a couple words just for the folks out there that'll want to push back on the local decision and about remote. It is not virtual learning. We've already said that the governor has put forth over 1,000 access points for Wi-Fi. We're trying to expand that. I know we've not talked about that in a while, but it is moving very, very fast and forward. The remote learning is reserved for extreme circumstances. It should only be exercised when justified by increases in community spread, and it should not take away from options for families. Remote learning is not equitable for all students. A large number of our students and families don't have access at home. Many families don't have the resources to be at home with their children when we're asking them to go back to work. There's nobody there to keep their children on task. Young children especially suffer when learning remotely because they don't have the cognitive ability to learn on their own. They need an adult with them. This is the power of our teachers and what they bring each and every day. Delivering paper packets to students once or twice a week is something we've done in an emergency, but it is not, it's just not going to work for our most vulnerable populations, especially those that are disadvantaged, special needs. And while this was necessary and something that folks are going to look back to in the spring that we did, we are still reserving that, and we thank the governor for still reserving that in extreme circumstances when a county is red, that we do have the ability to still offer that. So I wanted to clarify that. Let me clarify that also. Mm-hmm. And then also back to the testing. The question's been brought forth about the testing this week, and we are moving very, very fast on that. If a student, participant, athlete, band member, if they refuse to test, they are not going to be able to play in their game this week or participate in the band at the event. That will be required. They will have to test and test negative to be able to participate.
The only thing I would add is this, and I'm just asking you, Clayton. Let's just say we set up a time, and that time is set up today, and you know, certain kids we can't get a hold of or whatever it may be, and everything. We're going to have just some level of fallback and everything where they can get tested.
And Governor, you're absolutely right. We're going to try to hit as many of those teams today as possible with their coaches. We will work directly with the local health department, DHHR, SSAC. We'll make sure there's some make-up times there for parents who can't get it done quickly today.
I think that's good. Okay, if I could wrap up, you know, I'm like I said, on one hand, I've got to be, you know, I've been a coach forever. I understand the desire and the commitment and how hard we work and all that kind of stuff. We're trying any and every way we can. I'm really excited if we can get those teams from Logan and Fayette and Kanawha on the fields, or you know, in the bands performing or whatever. That's great stuff. The good Lord has granted us this week before we get back into school. But just think with me just 1 second. And that is, this week has given us the bridge, the ability to motivate, to build, the ability to try with all in us to obtain more medical information to prevent the spread. Absolutely, if we find people that are positive, we'll get them out of the system from the standpoint of being able to spread. We will help them in every way as we help these counties go from orange to yellow or green, and that's where we want all of our counties, and that's what, you know, that's exactly the goal here, that all these people, and I thank them for coming today. I thank them for all the phone calls. I signed off with Brother Marsh here last night. My last text to him was probably about 12:30 this morning, you know, but the long and the short of it is they've done great work. I think we're going to be able to get our kids back, you know, on the fields and everything. We hate it like crazy for Monroe County, but Monroe County, just hang with it. We'll get you through this, and we'll get you back and everything. And we want Monroe County back in the green just as fast as possible, or absolutely the yellow. But we'll take the yellow, but we want the green. But anyway, God bless each and every one of you. Everybody here is giving it all they got. Thank you so much.